Hello everyone, today we will discuss about the mandible. It is the bone of the lower jaw. It is the largest and the strongest bone of the face. Firstly, we will talk about the parts, that is the morphological features of the mandible. Now mandible has three parts. The one is the horizontally oriented plate, that is the body, and two the vertically oriented plates called the ramus. Now, there are three angles of the mandible. The first angle of the mandible is called the anatomical angle, and that is formed between the meeting point of the inferior border of the mandible and the posterior border of the ramus. Another angle is the surgical angle. That angle is formed between the anterior border of the ramus and the superior alveolar border. Now there is the third angle, that is the radiological angle. That angle is formed between the anterior border of the ramus and the upper teeth border. The body have two surfaces, that is the external surface and the internal surface, and it has two borders, that is the superior border and the inferior border. Now if you talk about the external surfaces, the external surface of the body has two halves, that is the right half and the left half, and both the halves meet in the center and fuses and form the faint ridge that is known by the name symphysis mentae, and that symphysis mentae expands downwards and forms the part of the chin that is called the mental protuberance, and that mental protuberance is limited on both the sides by the mental tubercle. Then there is the presence of the mental foramen on both the sides between the premolars. Then there is the presence of the oblique line, and that oblique line is the continuation of the anterior border of the ramus that runs downwards and forwards towards the mental tubercle. Then there is the presence of incisive fossa. That incisive fossa is a shallow depression that is present just below the incisors teeth. Internal surface. Now the inner aspect of the symphysis mentae has genial tubercles. That is the two upper genial tubercles and two the lower genial tubercles. Then there is the presence of the mylohyoid line. Now this is the prominent oblique ridge that runs downwards and forwards from the third molar to the symphysis mentae below the genial tubercle. Then there is the presence of the mylohyoid groove that lies below the posterior end of the mylohyoid line. Then there is the presence of the sublingual fossa. Now that fossa lies above the anterior part of the mylohyoid line and it lodges the sublingual gland. Then there is the presence of the submandibular fossa. Now it is present below the posterior part of the mylohyoid line and lodges the submandibular gland. Now we will talk about the ramus. Ramus is the quadrilateral vertical plate of the bone that projects upward from the posterior part of the body. It has two surfaces, that is the lateral surface and the medial surface, and it has four borders, that is the anterior border, the posterior border, the superior border and the inferior border. And it has two processes, that is the coronoid process and the condylar process. Now the coronoid process is the projection from the anterior superior part, and the condylar process is the projection from the posterior superior part. Now it expands upwards, and this part is known as the head, and below that head is the constricted portion, that is the neck. There is a depression on the anterior surface of the neck, and that is called the pterygoid fovea. Now if we talk about the lateral surface, now lateral surface is the flat and it possesses a number of oblique ridges that is produced by the masseter muscle. Now we will talk about the medial surface. Now there is presence of the mandibular foramen. Now that mandibular foramen leads into the mandibular canal and runs forwards and downwards and opens into the mental foramen. Then there is the presence of the tongue-shaped projection on the anterior border of the mandibular foramen, and that is known by the name lingula. As we already know that this is the superior border and this is the inferior border. So near the inferior border, there is the presence of the two fossa. Now that two fossas are known by the name digastric fossa, which are present on the either side of the midline. Now we will talk about the muscle attachment on the body of the mandible. The first muscle is the buccinator muscle that arises from the oblique line below the third molar tooth. The second muscle is the mylohyoid muscle. Now that muscle arises from the mylohyoid line. The another muscle is the genioglossus and the geniohyoid muscle. The genioglossus muscle arises from the superior genial tubercle and the geniohyoid muscle arises from the inferior genial tubercle. Then there is anterior belly of digastric. Now that arises from the digastric fossa present near the midline at the base of the mandible. Then there is platysma. Now that platysma inserted onto the base of the mandible. Then there is superior constrictor. That superior constrictor is somewhat present here and it arises from the area above the posterior end of the mylohyoid line. Mentalis muscle is present somewhat here. Then there is the depressor labii inferioris that is present below the mentalis and in front of the mental foramen. And then there is the depressor anguli oris muscle that is present below the mental foramen. Now we will talk about the muscle attachment on the ramus of the mandible. Now there are the four muscles and that muscles are the muscles of the mastication. The first muscle is the masseter. Now that masseter is inserted onto the outer surface of the ramus. The second one is the temporalis. Now that temporalis is inserted onto the coronoid process on its tip, anterior border and on the inner surface. Then there is the lateral pterygoid muscle that is inserted onto the pterygoid fovea which is present in front of the neck. Then there is the medial pterygoid that is inserted onto the inner surface of the ramus above the angle of the mandible. Which angle? The anatomical angle.